So it's so nice to meet you, Eydie. What I'd like to do is have you introduce yourself and explain the system that you work in, the institution, and what your area of scholarship is. Why don't we start that way?
Yeah, absolutely. Thank you so much for having me. I'm really delighted to be here and engage in this thought-provoking and essential conversation. So my name is Eydie Kramer Kostecka. I'm a research professional at the University of Minnesota. I've done quite a bit of work in the realm of community engaged research, particularly in rural spaces in South Central Minnesota. And I also do an equal share of work in the metropolitan Twin Cities area in Minnesota, the Minneapolis and St. Paul region. My work there really centers around community partnered fitness interventions and programmatic interventions that take place in parks.
Thank you. How long have you been working in this field, Eydie?
I've been at the University of Minnesota since 2015, but my work in recreation, pool and park-based recreation in particular, spans beyond that. I did quite a bit of community-based work at camps across the United States since I think it was around 2012 or so. So I've been out in California, Colorado, Wisconsin, and Florida, and really enjoyed the work I did in that aspect. A lot of work that was partnered with community-based facilities like YMCA's.
Yeah, very good. Let me get situated with the one thing that I want on the screen. So give me 1 minute. And these are two of your uh, publications abstracts that have been made public in the last few years. And so I thought we would start by talking about them. Why don't we talk about mapping community and neighborhood level access to rural physical activity built environments? Well, let me back up first. How do you explain the built environment to people if you have to explain it, um, let's say in a public meeting? Do you talk about it? How do you talk about it?
Yes, absolutely. So when I think about the built environment, I think about it in a very practical way and a person-centered way. So if we were to ask our neighbor or a colleague about the built environment, we'd really be talking about the environment that's most pertinent to them. So what's available in your neighborhood, right? So what assets are available in your neighborhood? That could be a combination of natural assets and then man-made assets as well. So do you have access to trails in your neighborhoods? Do you have access to sidewalks? Are those sidewalks interconnected or are they disconnected where sidewalks and trails are only on one side of the street or you have to cross a very busy highway to get to and from access points in your neighborhoods like a school or the grocery store? I'm in the field of physical activity, so I particularly think about the built environment in terms of what's available that can facilitate active behavior. So I might ask somebody, what's available in your neighborhood that you can easily utilize with pedestrian methods, so by walking or riding your bike, or if you were to use public transit or a personal vehicle. So are you able to get to a pool in your neighborhood? Are you able to get to a nearby park? Is there a community center in your neighborhood? And then are there a variety of other public assets in your neighborhood that support health behaviors that are so important and complement physical activity? So for example, do you have a neighborhood grocery store? Are you able to access all the groceries that you need at that store? Would you have to find another means of transportation to access, say, for example, fresh fruits and vegetables? Do you have a library in your neighborhood? Do you have a place where you can meet with folks and engage in joyful social interaction, things of that nature? So really, if you were to do just a bird's eye view of what's available in your neighborhood, I would ask somebody, please describe to me what you can walk to. And then maybe what could you drive to within 10 minutes that's easily accessible for you and your family?
Those are really good questions. I like that. That makes it very simple. What can you walk to and what can you drive to? And then thinking about what you cannot get because you can't walk to it and what you cannot get because you can't drive to it. I love that. That's very, very straightforward. So looking at what you did, oh, around 2022, where you mapped the community and neighborhood level access to physical activity in built environments, what did you find out from that mapping when you did that?
Yes, that's a great question. Gosh, I think it was back in 2018, I was involved with a team that had implemented a physical activity and healthful dietary intervention in and around a moderate-sized town in the Midwestern area of New Ulm, Minnesota. It's in the south central portion of Minnesota, and this is a rural town that's actually quite dispersed from metropolitan hubs, right? So if you think about, or that question, how long would you have to drive? If folks living in New Ulm, Minnesota had to drive to the nearest metropolitan hub, it would take them at least half an hour to an hour to get to some of those hubs that have larger hospital resources and things of that nature. And I was part of the team who was involved in the physical activity programming. And as we were going down week after week to work with families that included parents and rural children between the ages of 7 and 10 years old, we heard a lot of stories from the families about what was available or what was not available in their own community as it relates to physical activity built environments. So thinking about those pools, those parks, trails, sidewalk networks, things of that nature. Importantly, the families who are part of this new home study in New Ulm, Minnesota, they came from a variety of rural communities that were interspersed around this rural hub, right? So it was a small town, but it was a rural hub. And then there was a variety of much smaller rural communities that were clustered around New Ulm, that's that small rural community in Midwestern Minnesota. And we heard that particularly the families who lived in the more isolated rural communities, they were having, I would say, barrier upon barrier to physical activity access that folks in New Ulm certainly knew about, but really, if we were to have a focus group, I think it would be a tale of two different environments, right? So if sometimes folks think about rural spaces as very homogenous, and that oftentimes when we talk about that rural-urban discrepancy, it's really like putting folks in two different boxes. And we know if we actually go to those actual towns, communities, and we talk to folks, there's varying levels of rurality, there's varying levels of access in metropolitan spaces. So
I did find that when I worked in West Virginia, there were urban spaces in West Virginia, and then there were extremely rural areas. And so while we think of West Virginia as a rural place, it's very different. They're discrete areas with different levels of access. So I understand that point.
yes, absolutely. And I'm sure the work that you conducted as well, you heard those stories, right?
Right.
Of almost those tales of two different experiences, even when our intervention was titled a rural intervention, right? So in a way, it starts to group and cluster and maybe create this myth that all rural spaces or all metropolitan spaces are the same. So then based on that, I was really intrigued by those different levels of access in terms of, can you walk to this resource or can you drive? And if I can back up a little bit, I think that our personal stories, by sharing them, I think it helps us to more fully own our stories, and it causes us to be perhaps more attuned researchers. So I come from a rural space, and my family was significantly low income as I was growing up. And at certain points in time throughout my childhood, we didn't have access to a car. So that was something that I think just my interpersonal story and my background and my identity informed that interest in, again, this concept of what can you walk to in a rural space and what can you drive to. Folks who have grown up in rural areas, they're very aware of the fact if you're in more of an isolated rural community and if you don't have access to a car and if you don't have access to neighborhood assets that you can walk to, it's actually quite difficult to get to the places that support your health. in particular, in my case, I was studying physical activity environments. So I worked with a team of geospatial analysts at the University of Minnesota, and our interdisciplinary team also included community-based experts. And together, we mapped a 7-county region that included that rural hub town of New Ulm, and then the dispersed, more isolated rural communities in and around New Ulm. And in particular, we were really interested in categorizing folks according to 2 indicators of access. And we were really thinking about that question, what can you walk to and what can you drive to? In terms of what you can walk to, a very well-known indicator that you can use is walk score. In particular, based on individuals' address, you can easily access walk scores and understand are our assets walkable in this community. Then in addition to that, the indicator for vehicle travel access that we used was rural urban commuting area codes, or RUCA codes. So with these codes, a 4 or a 5 would indicate that the area that you live in, it's a little bit more accessible by vehicle. If we're getting up on the scale to a 7 or 10, we're starting to see that these areas are very significantly dispersed and isolated rural areas, right? So very long driving, commuting times between the various communities. And we clustered the cohort of participants according to these various indicators of access. What can you walk to? Can you drive to? And I think not very surprising, but just in terms of being able to show something that seems to make good sense when we think about it, we did find what we hypothesized is those who lived in areas that had the least walkable access and the least drivable access. Geospatial analyses corresponded with that there was very limited access to pools, parks, sidewalk intersections were more restricted, so that connectivity was restricted. And then also perceptions of physical activity access were low, and child-reported physical activity was the lowest within that group as well, right? So just something that I think those of us who maybe have experienced that varying level of physical activity built environment access in terms of I'm having a difficult time walking to these assets, and I might also have a difficult time driving. We understand that, right?
Yes.
But I think it is important to be able to show that with the data as well.
I like your use of the word or the idea, show it with the data. So in my research in West Virginia, I did many interviews with residents in West Virginia. So I have a website with all of those interviews. And maybe I'll play one of people talking about their experiences with grocery shopping, going to work, one woman going to take care of her diabetes. And so just tons of interviews. What we tended to focus on were policy interventions. So could we fund the public transportation system differently so that people were not standing on the side of very dangerous highways flagging down a bus? Could we fund the building of sidewalks in a city in a different way so that people didn't have cracked sidewalks or incomplete sidewalks? What else did we look at? But those were the kind of interventions we were looking at. What kinds of things do you propose when you find this kind of data?
First of all, I just wanted to commend you on the research that you're doing, because I think that's so important, is to go out into the community and to have those conversations about what affects people on a day-to-day basis, and for lack of a better term, real life implications, right? So the danger of standing on the edge of the street, and how that plays into that impacts our behavior. Are you willing to send your children unsupervised in that area to get on a bus or to go to school, right? And that impacts everything, has these downstream trickle-down effects on people. So I just wanted to commend you for the work that you're doing and to get those stories forward. In terms of what policy interventions or what more environmental strategies could we enact? I think busing is a really important thing to hone in on. I haven't done that yet. That's not something that I've done. I have colleagues who work more in the transportation equity side of things, but particularly for folks who are in these rural physical activity deserts, we really need to think of a variety of strategies that really lean into public health, like public health interventions that we know work and that we know that people need, right? Because there are some interventions that I think are very creative and are very important that are behavioral in nature. And I don't want to say that that's not important to lean into, but we also have to think about the socio-ecological model and
Mhm.
what are some of these large policy strategies and innovative, creative coalitions we can build, right? And could that be busing, creative busing, to work with county level officials to see if we can get busing out to these more isolated rural areas. For example, if you're offering a swimming program and there is only one publicly available pool in an entire rural county, how are you going to ensure that children who are dispersed in Minnesota counties tend to be quite large, who are dispersed in various corners of these counties, how are they going to get to that pool? And it certainly will not be an active transportation intervention. That really has to be a public transit intervention that we're going to be working towards.